Hey guys, welcome. My name is Dr. Mike. I am a home health physical therapist. I see quite a bit of patients that come straight from the hospital back home, and they always ask me, how can I stay limber? How can I stay flexible? Here I'm going to teach you 5 stretches that I love to use with my patients that help improve flexibility and will get them going with standing up and walking. So the first one we are going to get into is going to focus on our adductor muscles. And for today's video, we are actually going to use a few items. I have a PVC pipe, which you can also use a broomstick. And I also have just a regular strap or a belt here. Now you don't need a resistance band. You actually need like a belt, something that is pretty secure and not as elastic. So first one we're going to get into, I like to call a butterfly stretch. We're going to lay on our back here. And as I'm laying flat on my back, what I'm going to do is take my knees and I'm just going to allow them to fall down at the side. My feet are actually together. And if I'm doing this correctly, what I should feel is a nice, good stretch on the adductor muscles, the inner thigh muscles there. Now, especially our patients that are doing a lot of sitting at home, those adductor muscles just get really tight and like to lock up on us. So this is a great way that we can release these. And I'm going to take a couple deep breaths, and I'm going to hold there for about 20 to 30 seconds there. So we call this our butterfly stretch, okay? Very good now. Okay, we are now gonna work on moving on to our knee to chest. And so for the purpose of the video view here, I'm gonna allow this left leg to straighten because this is the side that I'm going to stretch. I'm going to bring my right knee up as far as I can go. And what I should be feeling here is a nice good stretch on the anterior hip capsule here. I don't want my leg on the bottom turning out or turning in, so I'm trying to keep that leg down and extended with my toes facing up. And so here I'm going to focus on, once again, 20 to 30 seconds, holding here, taking some deep breaths. We should never be holding our breath or performing any Valsalva maneuver during this stretching routine. After I have done one side, I can go ahead and alternate and go to the opposite side. Trying my best to keep the leg that is down nice and straight and extended, and trying my best to bring this knee up as high as I can take it. Very good for hip flexor flexibility, especially to prepare us for some walking. Now the next one of my favorites, is called a hamstring stretch, also known as some hamstring flossing. And this is really good if you deal with any lower back pain. This might relieve some of that. And so I'm going to focus on my left side first. I'm going to grab just behind my knee. If it's too difficult to reach your knee, you can always use a towel or a strap to wrap around so you can have access to the back of your leg. What I'm going to do now is nice and slowly, I'm going to take up tension in my hamstring. I'm going to try to straighten my knee as far as I can, and then I'm going to come back. Just like with all the other exercises, you can work on this for about 30 seconds. And each time what I'm trying to do is basically straighten my knee as far as I can go. And notice I'm trying to bring my toes up towards my nose if I can tolerate that. We do have that sciatic nerve that runs on the back of the hip all the way down our legs. So some of you who have a history with low back pain, if you try too hard with this stretch, you might feel a lot of pulling or burning sensation behind the knee or even in the calf. We do not want you to push through that. So we want you to go just up into that tension and then come back down. So everybody's flexibility is going to look a little bit different there. Okay. And then we would work on the other side. For the next one, I'm going to grab our PVC pipe or our broomstick if you have that. And now we are going to focus on our pec, which is our anterior chest and shoulder muscles. Using the broomstick, the wider you go, it's going to be a little bit easier on the shoulders. If you're dealing with any pinching feeling, I don't want you to raise your arms too high. But what you're going to work on, once again, for 30 seconds, all you're trying to do is really stretch out the front of your chest, the shoulder muscles, the core, keeping your back as flat as you can. We don't want you arching and trying to overpressure your elbows up overhead. I want you to try to keep your body nice and flat. It really doesn't matter if you want to keep your legs extended or if you want to keep them straight or bent. I'm going to leave that up to you guys. Feels nice and good as I bring my arms over my head. And as it gets easier, I can go ahead and even bring my hands closer together there. Perfect. We are going to now move on to our Piriformis stretch, also known as the figure 4. And with this one, I'm going to flex one knee, and then I'm going to focus right now on my left hip, bringing my shin right over that knee here. And now what I should be feeling is some pulling behind the hip here. And I can even work on just working through that motion, pulling that knee up towards my opposite shoulder. And even push it out to feel a nice little capsule stretch on the inside of the hip. So notice I'm not just holding here just like your typical piriformis stretch. I'm actually encouraging you to work through some of that motion in your hip, especially because we know we're going to need all that motion and all that strength when we start to stand, when we start to walk. And then you would also do the other side there, okay? The last stretch that we're going to get into, which I feel like gets neglected quite a bit when people are laying down in the bed because they're not standing or walking, is we're going to call this a calf stretch. Now the calf is composed of two muscles. One, the gastrocnemius, which is stretched when we have our knee straight, and also the soleus muscle, which we stretch when we have our knee in a bent position. So we can actually work both muscles here just by the position of our knee. And so I really like to have my patients actually wrap this band around, because since we're not, patients that are not doing a lot of walking or maybe not doing a lot of standing, they lose the flexibility in their calf quite fast. And so what we're trying to do is prime those ankles and get them ready for standing so that when we stand, we don't feel as stiff in the morning. Okay, so this is actually going to go at the top of my foot, not at the bottom. So notice it's on the top area here. And I'm actually going to keep my knee extended, so we're focusing on that gastrocnemius muscle, and I'm going to pull my toes up towards my nose, trying my best to sit up nice and tall if I can. I never want us in this bad posture here, okay? So we're trying to sit up nice and tall, and you're going to already start to feel that tug behind here. Once again, it's all about going into an uncomfortable feeling, but not giving yourself pain where you're flaring your body up, okay? So once again, 30 seconds here, and you also would benefit from a soleus stretch, which we talked about earlier. Instead of our knee straight, we're going to go ahead and bend that knee, and I'm going to do the same thing. This is why the yoga strap or a gait belt or something like a towel is just a lot better for this exercise, because a resistance band that gives, you're not going to be able to really get enough leverage to pull that top of the foot upward. And so I want you to really get a hold of that. And once again, we're holding for about 30 seconds here, trying to sit up nice and tall there. Okay, so that's about 5 stretches that I love using for my patients to improve flexibility, especially if they're spending a lot of time in the bed. You may be able to work on 2 of them. You may be able to work on 3 of them. not a problem. Over time, it will get easier. It should get easier. And you can maybe even hold those stretches instead of 30 seconds for about 60 seconds at a time. So I hope you found this video very helpful. If you have, please, to support me, you can give me a like and even subscribe. I'm going to try my best to start uploading once a week to provide you older adults a resource to stay fit, healthy, and just mobile so you can live your life with no limitations. I want to thank you, and Dr. Mike is out.